Martha Mills was admitted to hospital after a bike accident. She developed sepsis. Her parents raised concerns, but the symptoms were missed. She died, aged just 13. Martha's rule is her legacy. It gives seriously ill patients access to a second opinion if their condition worsens. 2/3 of hospitals can apply to the scheme from April. But it comes too late for Richard Huff. He was admitted to hospital in 2017 with suspected appendicitis. His daughter tried to raise the alarm that he was increasingly unwell.
I'd call the hospital and say, something just doesn't feel right, I'm really sorry, is he still okay? And eventually they asked me to stop calling because I was getting in the way. And it turns out that in the night he'd actually been taken to ICU with complete organ failure and sepsis.
Richard eventually recovered, but spent his remaining years struggling with the effects of sepsis before he died.
Had the sepsis been caught sooner, had our concerns been listened to, I think we would still have him now. And I think he would have enjoyed the last remaining years that he had with the family more.
Some hospitals already have their own version of Martha's rule.
We had a call from the daughter just saying that she was concerned.
The Royal Berkshire Hospital has a hotline for people to ring if they have worries over a patient.
There's been a few incidents where we have received a call for concern from a family member, and when actually we collate all of the information we have about that patient, that's resulted in us changing treatment plans or admitting that patient up to our intensive care unit.
While patients and their families will welcome Martha's rule, there are still serious questions about whether an already overstretched NHS can cope with offering second opinions.
But NHS bosses say it won't create further pressure on doctors.
Well, every doctor, every clinician wants the best outcome for their patients. So I think this will be welcome throughout the health service. My sense, talking to people in hospitals, is that they want us to bring this in.
Martha's rule comes too late for some families, but now the hope is that a second opinion will give some patients a second chance. Alice Porter, Sky News.